You, like many other parents, may be worried that if you take your depressed teenager to see a psychiatrist like me, they're going to push medication on them without understanding them or getting to the root of the problem. And concern is real. Just recently I received a comment from one of our viewers asking if doctors get pressured to prescribe medication at the first appointment because it feels to them as if it's almost like a knee-jerk reaction. And in a way, the answer is yes. Because there are multiple pressures, but they are not coming from drug companies. They're coming from something a lot closer to home. I'm Dr. Ruben Gagarin, child and adolescent psychiatrist. First, let's be clear. We are not talking about severe mental illness like schizophrenia or bipolar disorder that often comes with psychosis. Because if you believe that you have a direct link with the God, you're not going to listen to a mere psychiatrist. So medication is a necessary prerequisite before any other work gets started to bring a person back to reality. We're talking about something that is more nuanced, like depression, anxiety in teenagers. It is crucial to understand that anxiety and depressive disorders are escape in a way from overwhelming reality. It is hard to be a teenager these days. There is a lot of pressure about fast-changing future, a pressure to choose the right career, academic pressure, interpersonal social pressure, etc. So when they come to see a psychiatrist, that is often a way for them to find the relief from these overwhelming negative emotions. In a way, they are looking for escape from the escape. By the time even you, parent, realize what's going on and bring them to see me, they had probably already watched thousands of videos about coping strategies on TikTok and tried like a dozen of different skills like exercising, maybe meditation apps. So they usually come to see me because the easier ways did not work. And both parents and teenagers are in pain when they come to see me. They often cannot sleep, they don't eat very well, they may even have suicidal thoughts. As a parent, you feel their pain. You see them locked up in a dark room, losing their spark, not enjoying their life or time spent with the family. You know what they're supposed to do, like exercise, take walks, etc. But when you try to pull them out, they just snap at you and refuse to do what is right for them. I see many families where teenagers refuse to even go to school. That's how depressed and overwhelmed they are. If you happen to live in a place where a child psychiatrist like me is even available, and then you went through the wait list, so you finally came to see the doctor, you shared your pain, and your teenager is looking for some relief, finally, you don't know what to expect, but I'm going to tell you. There are two ways. One, that your teenager should now go to the gym 3 times a week, meditate every day, and the whole family should start changing the way how you communicate, adjust, add there a healthy diet, and changing sleeping patterns. Of course, we're going to connect you with the therapist at about $100 to $200 an hour, and that would be weekly sessions. So you should continue with that for about 6 to 12 months to get to recovery. So we're talking about something like between 25 and 50 sessions. Alternatively, I can prescribe your teenager once-a-day medication, and in about 2 to 4 weeks, you're going to see an improvement. That is a lot much less commitment. What approach has a better chance to work? Well, according to Journal of American Medical Association, I'm going to leave a link in the description, only about 50% of people who walk away from the doctor's office with a prescription take their medication as doctors prescribed. And that's not mental health, that's just general medicine. When it comes to lifestyle changes like sleep and eating, guess what? It's only about 10%. Those numbers are shocking. So 50% take medication, that is very small commitment. It's only a pill a day, usually, maybe twice a day. And only 10% actually stick with the lifestyle changes. So even before we start our appointment, this is the numbers I have to work with. I know if I prescribe medication that there is a 50% chance that your child will stick with it long enough to see the improvement, and out of the 50%, about 70% get better, so we have 35% chance of recovery, and if I prescribe lifestyle changes alone, that's going to be probably about 10%. Of course, with accountability, weekly appointments with a therapist, again at about $150 a week, then there is some accountability, so we have better results. However, the numbers are still pretty low. And there are layers. So another layer is that after many months, at least weeks, but usually months, waiting for the appointment with psychiatrist, your teenager is looking for relief. And if at that point I recommend exactly the same thing, what they already saw on TikTok, they're probably going to feel rejected by their doctor, and they may feel as if I'm blaming them for being lazy and for being depressed. But if I acknowledge that they have a medical condition, if they indeed meet criteria for major depressive disorder, then they are more likely to stick with my appointments, and then eventually we can get to psychotherapy and lifestyle changes. There is a really deep layer. As I said, anxiety and depressive disorders are ways how people tend to escape their overwhelming reality. So if they come to see me with expectation that I'm going to give them a pill that will help them to escape reality more, then nothing is really going to work. An expectation to find a substance that will help escape reality more, that is not path to see a psychiatrist, but rather a path of developing drug addiction. Because weed, alcohol, and other drugs, they make a person feel as if they are escaping. It numbs their emotions, so they don't feel the pain. Of course, it is only temporary. The pain comes back with a vengeance, and then a person will now have to deal with addiction on top of their depression, anxiety, and whatever else caused it in the first place. Alternatively, some teenagers come to my office expecting just a little push. Almost like if you imagine that you're building an inner citadel, you need a scaffolding to erect the walls. So the medication may be that scaffolding. So if a person is giving up on their school and their future, they're feeling hopeless, maybe even considering suicide, then they're probably not going to go do yoga 3 times a week. But they may be motivated enough to take a pill every day. Then we start building the scaffolding, and then once they feel strong enough to start bringing in bricks, then we can connect them with a therapist. Or maybe at that point they don't even need to see a therapist if they are motivated. They can pick up a workbook or start benefiting from that advice that they find on YouTube or TikTok. At that point, you, the parent, become the most powerful force in your child's life. The best thing you can do is to lead by example. Because guess what? You're probably stressed. Your child probably knows you're stressed, and them being stressed about you being stressed makes them more depressed. But you can change it around. You can show them that you take care of yourself and how you do that, and then they can learn from you. They also get reassured that if you're taking care of yourself, then you should be able to take care of them. You should guide them. You can show them the right steps. You can help the family with healthy habits, maybe taking walks. Start small, and then you can increase whatever works. Journaling is a great way to show that you're taking good care of yourself. In the description, I'm going to share a link to a free starting kit. Make sure you share in the comments your personal examples, how maybe you realize that you're trying to escape your problems as opposed to addressing them, and how you escape the escapism, and maybe you had some positive or negative experiences with other psychiatrists or medications and other treatments. Thank you very much for watching. Come back for more. Bye-bye.